a quarter to eight, where the pandemic has resulted in a huge upheaval for so many of us. Work, family, play, entertainment, everything's been turned upside down. The list goes on. So what about those with disabilities? How has COVID impacted on their lives? Australian Communities Foundation has been looking at just how support networks have been fractured. Their CEO is River Knight. Morning, River.
Good morning. Thanks for having me.
River, what impact has the pandemic had on the disabled in our community?
Within the community, we have about 4 million people in Australia living with a disability. So it's about 18% of the population. About 1 in 10 of those access the NDIS. And what we've seen from the statistics coming from the NDIS is that about 34% of the funding that people have access to wasn't able to be used last year because people weren't able to access the important services that they needed to day because of the COVID restrictions, but also that systemic problem of just trying to connect with service providers with such a big program.
Yep. Have support services been cancelled?
Some services had to be. So some of the community access programs where people come into a person's home, help take them out shopping and things like that, had to close down because of the restrictions. So only those real essential services were really able to operate.
Yeah.
But those services that closed down really impacted on people's mental health.
Yeah.
And also it's a big trauma to then try and work on that long road to get people back into the community safely.
That disconnect really affected people with a disability in a big way. What sort of stories? I mean, you mentioned mental health there. What sort of stories are you hearing?
Well, for example, a lot of the appointments that people go to, such as their psychologists, their psychiatrists, those health appointments, have changed to more electronic formats, and we still see that now happening. But a lot of people with intellectual disability or mental illness, they really need the face-to-face support, and it's really hard to do that on an electronic media platform. Even though it's fantastic that it's available, some people just need that face-to-face. So it might take us a couple of months just to help someone feel safe enough to get back into those independent skills like going shopping, going out into the community, and starting to be connected again.
Yeah, I can imagine this would have led to a lot of feelings of loneliness as well and isolation.
It is because it's a population of people that historically have experienced that marginalisation and that devaluing in our community. So we want to see people in the community, seen and valued in the community. And we want to make sure those support services are back up and running as fast as possible. But in general, over the last few years, we've found that there's a disconnect where people have a really hard time navigating the 15,000 service providers plus that are registered in Australia because it's such a huge list and it's really hard for people to find a service and connect with them, which is why we're doing the expos and the events that Australian Communities is doing.
Yeah. So a lot of the NDIS services out there are actually being underused, aren't
Well, I think it's can be really tricky because if you've got, say, 6,000 service providers registered in Queensland,
they?
if someone gets a plan and says, hey, you can access these services now, you can imagine just trying to figure out, well, which service do I access? Which one's a good one? Which one's a bad one? Which one has staff that I'm going to really enjoy working with? Which ones, don't have stable staff? Which ones are going to really come into my home and connect well with my family? And that's a big job for someone to do. So they need that support to do it. We have different versions of that. So people might go to their local area coordination service, which the LACs do a really good job of providing people with some of those contacts. And then some people have like what they call a support coordinator funded, which is kind of like a caseworker that really helps get the funding going and getting them connected into services. But first they've got to find the service. So we try and get them to come to our big community events and our expos that Australian Communities run so that they can find those services and have a conversation and find someone they really feel comfortable with.
Yep. And so is there a message then to providers to really reconnect with those in need?
I guess there is, and I've already seen that with the service provider connection network that we have in Australia, where everyone does talk to each other. We do work well together, and there's a big push to make sure that people are out and about at events to provide that opportunity for people to connect, because it's such a personal thing, disability support services. It's not like just going and buying a loaf of bread. You've got to find someone you feel really comfortable with in your own home. So we're making sure that all the service providers have those opportunities to really connect with people.
Yep. And for those with a disability, what would your advice be to them to make sure they don't lose out?
One thing that is working really well is the peer support groups, so advocacy, but also those social media networks, and then coming along to free events, the ones that NDIS hold themselves, as well as the other community events like people like ourselves are running, so that they can connect in a way that's going to be really authentic.
And River, is there a website people can access?
So our new website, which people can go to find all of the events that we're holding within the community around Australia, is developing AUS communities, all one word, .com.au.
All right, let's hope they access the services that are desperately needed. River, thanks very much.
No worries, thanks for having me.
Australian Communities Foundation CEO River Knight on